Hello guys, today we are going to discuss about a laboratory test, blood test called cortisol. Cortisol can be measured in blood, saliva, urine. But now let us discuss about cortisol test blood. Use of the test to help diagnose Cushing syndrome or addition disease, primary adrenal insufficiency or secondary adrenal insufficiency. When to get tested? If your doctor suspect an underactive or damaged adrenal gland with too little production of cortisol, or a condition that could result in the body producing too much cortisol, ensure your healthcare professional is aware if you are currently or recently have been taking steroid medication such as hydrocortisone, prednisone, prednisolone, dexamethasone, as this can affect test result. About cortisol. Cortisol is a steroid hormone produced by the adrenal gland, which is essential for survival. Cortisol is a steroid hormone that breaks down fat and protein and stimulates glucose production in the liver. It helps the body react to physical and emotional stress, help to regulate blood pressure, to control inflammation, and can affect cardiovascular function. The production and secretion of a cortisol is stimulated by adrenocorticotropic hormone produced by pituitary gland, a tiny organ located inside the head below the brain. The concentration of cortisol in the blood increases during the times of stress, and it also helps regulate the immune system. Heat, cold, infection, trauma, exercise, obesity, and debilitating disease influence cortisol secretions. The hormone is secreted in a daily pattern, circadian rhythm, rising in the early morning through several pulses peaking around 8 a.m. and declining in the day to lowest concentration in the evening. The circadian rhythm can change in a long-term night shift workers. Adequate concentration of a cortisol within the blood can cause non-specific symptoms such as weight loss, muscle weakness, fatigue, low blood pressure, abdominal pain, and exposure to stress can cause an adrenal crisis that requires immediate medical attention. Decreased cortisol production may be seen as a result of an underactive pituitary gland or a pituitary gland tumor that prevents ACTH production. This is known as a secondary adrenal insufficiency. Underactive or damaged adrenal gland under adrenal insufficiency that limit cortisol production. This is referred to as a primary adrenal insufficiency and is known as addition disease. Too much cortisol within the blood stream can cause increased blood pressure, high blood sugar concentrations, obesity, fragile skin, purple streak on the tummy, and muscle weakness. Women may have irregular menstrual period and increased hair on the face. Children may have delayed development and a short stature. Increased cortisol production may be seen in result of ACTH producing tumor in the pituitary gland called Cushing syndrome, or in other parts of the body that stimulate the adrenal gland to produce cortisol. Adrenal gland tumor are due to excessive growth of the adrenal tissue. Sample. Typically, a blood sample will be taken by a syringe with a needle from a vein in the arm, but sometimes urine or saliva may be tested. Blood should ideally be collected between 8 to 9 a.m. when blood cortisol concentration should be near their nocturnal peak. A second sample may be taken late in the evening when cortisol should be at its lowest concentration, about midnight. Normal range. Morning 8 a.m. 5 to 25 microgram per deciliter. That is about cortisol.